What is Barrett's esophagus and how does it develop from GERD?
Yeah, Barrett's esophagus really is a change in the lining of your esophagus as a result of chronic backwash of stomach contents into your esophagus. Okay. And so we think that the injurious agent there is often acid, but it could be other gastric contents, including bile and other sort of proteins and other sorts of things. And it's kind of the way I explain it to patients is if you work with your hands really hard, your hands will protect themselves by developing calluses. And so if you have a lot of, backwash of gastric contents into the food pipe, then what will happen is the lining of the food pipe will change. So that it ends up being something a little bit more like the lining of the stomach or the small bowel. And so it undergoes this change in lining from squamous tissue to something called columnar, which better protects it from all that backwash. And that actually leads to a change in the color, which is how you can identify it in endoscopy. In fact, there was a British surgeon named Norman Barrett who first noticed that some of his patients with reflux had this funny color change, and that's why it ends up calling Barrett's esophagus. But the reason it's important is that it's really the only known precursor to esophageal adenocarcinoma, which is one of the two main types of esophageal cancer. It's actually the one that's rising, and unfortunately, esophageal adenocarcinoma has about a 17 or 18% 5-year survival. So it's actually a pretty bad cancer to get. And so this is the precursor lesion. And so by detecting Barrett's esophagus and assessing it and potentially treating it, our hope is to obviously avoid patients progressing to esophageal adenocarcinoma.
Oh, that's really eye-opening. Are you seeing an increase in your practice?
I think that, we know that obviously that this is a reflux-related disease. And we know that reflux is associated in large part due to our weight and BMI. And we know that that's obviously a issue nationally as a health challenge, right? And so we do see a lot more of this. And in fact, over the last 50 years, I mentioned there was two types of esophageal cancer. The other one is called squamous cell, and that was more associated with tobacco and alcohol use. And as we've seen specifically tobacco use sort of drop over the last few decades, that has gone down. And reflux related has actually gone up. So we do see, sort of a shift in sort of the lines are crossing. So we now have more adenocarcinoma than squamous cell, and so we do see more of this for a variety of reasons. Yes.